Namaste बिटिया हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this series, we are discussing about the diseases of the urogenital system. In the last sessions, we have discussed about various diseases like acute renal failure, chronic renal failure, polycystic kidney, nephrolithiasis, etc. Today we are going to start the discussion on benign prostatic hyperplasia. This is a very important disease and it is a very common disease of the old age. Almost all the individuals of greater than 60 years or 70 years of age suffer from this particular disease, male patients of 60 plus age group. So this is very common disease and is responsible for a lot of morbidity, that is the disease condition among the old age individuals. So what is benign prostatic hyperplasia? What are the various clinical features? How to investigate BPH and how to manage the cases of BPH? This we are going to discuss today. So let's start with benign prostatic hyperplasia. Benign prostatic hyperplasia. Before understanding the benign prostatic hyperplasia, let us start with the normal anatomy of the prostate gland. What is prostate gland, where it is located, and what are the various structures nearby the prostate gland? So prostate gland is basically related with the males, and it is a walnut-sized gland that is located between the bladder and the penis. So prostate gland, we have a walnut-sized gland that is located between the bladder and the penis. The prostate is just in front of the rectum. The urethra runs through the center of the prostate from the bladder to the penis, letting the urine flow out of the body. The prostate secretes fluid that nourishes the and protects the. So, as we have discussed, the prostate is basically a walnut-sized gland and it is located between the bladder and the penis. It is just in front of the rectum, and the urethra runs through the center of the prostate from the bladder to the penis, letting the urine flow out of the body. The prostate secretes the fluid that nourishes and protects the sperm. Now, what is the normal weight of the prostate gland? The normal prostate in adult male is around 11 grams, ranging from 7 to 16 grams. So the normal size of the prostate is around 11 grams and it is ranging between 7 to 16 grams. The enlargement of the prostate, it is nearly universal in aging men. As I have told you, almost all the men of greater than 60 years of age suffer from this particular disease. So normal prostate, it is ranging from around 11 grams and ranging between 7 to 16 grams. There is enlargement of the prostate and is nearly universal in aging men. It begins at the age of 45 years. So the enlargement of the prostate, it begins at around 45 years of age and it can go to any particular age. The volume of over 30 centimeter cube is regarded as prostatomegaly. So if the volume of prostate is greater than 30 centimeter cube, it is regarded as prostatomegaly, that is enlargement of the prostate. It occurs in the area of the prostate gland and is surrounding the urethra and produces urinary outflow obstruction. So prostatomegaly occurs in the area of the prostate gland surrounding the urethra and it produces urinary outflow obstruction. So it occurs in the area of prostate gland surrounding the urethra and produces urinary outflow obstruction. What are the symptoms of benign prostatic hyperplasia? There are some obstructive symptoms. There are some irritative symptoms of BPH. In the obstructive symptoms, there is urinary hesitancy, there is straining, weak stream, terminal dribbling, prolonged voiding, and incomplete emptying. So in the obstructive symptoms, we will have urinary hesitancy, straining, weak stream, terminal dribbling, prolonged voiding, and incomplete emptying. Irritative symptoms includes the urinary frequency, urgency to pass urine, nocturia, urge incontinence, and small voided volumes. So in the obstructive symptoms, we will have urinary hesitancy, straining, weak stream, trembling, dribbling, prolonged voiding, and incomplete emptying. In the irritative symptoms, there will be urinary frequency, urgency, nocturia, urge incontinence, small voided volumes. As the post-void residual increases, there is nocturia and overflow incontinence that may develop. Now we have another important score for the assessment of prostatomegaly. There is International Prostate Symptom Score, that is known as IPSS. In the International Prostate Symptom Score, there are 7 criteria on which it is assessed. Number 1, there will be straining. We have to check for straining while urination. Number 2, there will be weak stream. 3rd, intermittency. 4th, incomplete emptying. 5th, frequency. 6th, urgency. And 7th, nocturia times per night. So in the International Prostate Symptom Score, IPSS, we will be checking for straining, weak stream, intermittency, incomplete emptying, frequency, urgency, and nocturia, that is times per night. Each score 0, not at all, 1 less than 1 time in 5, 2 less than half the time, 3 about half the time, 4 more than half the time, and 5 almost always. So if all these things are not present, then 0 score is marked. If less than 1 time in 5, then 1. Less than half the time is 2. Less than half the time, about the half the time is 3. More than half the time is 4, and almost always is 5. If the total IPSS score is between 0 to 7, then the patient will be told as having mild symptoms. In case of score between 8 to 19, there will be moderate symptoms. And from 20 to 35, there will be severe symptoms. So 0 to 7 mild, 8 to 19 moderate symptom, and 20 to 35, there will be severe symptoms. Next, we come to the quality of the life. If the urinary symptoms in a patient are at the level of 0, then the patient is very much delighted. If the symptoms are at the level of 1, the patient is pleased. If 2, then the patient is satisfied. 3, there will be mixed symptoms. In case of 4, there will be dissatisfaction of the symptoms. 5 is unhappy, and 6 is terrible. So if the urinary symptoms are 0, then the patient is delighted. 1, the patient will be pleased. 2 will be satisfied. 3 will be mixed. 4 will be dissatisfied. 5 is unhappy, and 6 is terrible. Now, what are the various investigations that could be done in case of BPH? The most important investigation that we perform is the checking for the IPSS score that we have just discussed, International Prostate Symptom Score. The second test we can go for is uroflowmetry. Third is the digital rectal examination. Fourth is ultrasonography, that can be rectal or abdominal. And the fifth one is MRI. So the various investigation for assessment of benign prostatic hyperplasia includes IPSS, that is International Prostate Symptom Score, uroflowmetry, digital rectal examination, ultrasonography, that is rectal and abdominal, and MRI. Now we come to the management. The management of benign prostatic hyperplasia is divided into 3 main varieties. One is the medicinal management, the second is the non-surgical management, and the third one is the surgical management. In the medicinal management, if the prostate is less than 40 centimeter cube, then alpha adrenoceptor blockers are given. If the prostate size is greater than 40 centimeter cube, then 5 alpha reductase inhibitors are given. In case of non-surgical treatment, transurethral microwave thermotherapy, that is TUMT, it is a small device that sends computerized regulated microwaves through the catheter to heat and destroy the excessive prostatic tissues. The third variety is the surgical treatment. So in the medicinal, if the prostate was less than 40 centimeter cube, alpha adrenal receptor blockers were given. If the prostate is greater than 40 centimeter cube, it is 5 alpha reductase inhibitors. In case of non-surgical treatment, transurethral microwave thermotherapy was given. In case of surgical treatment, there is transurethral resection of prostate, TURP. Second is the LASIK surgery by holmium laser and enucleation. Third is the transurethral incision of the prostate, that is TUIP. Urolift system treatment that widens the urethra by placing the tiny implants that holds the enlarged prostate tissue out of the way. Open surgery and prostate artery embolization. So in the surgical treatment, we have transurethral resection of prostate, we have LASIK surgery, transurethral incision of the prostate, urolift system treatment, open surgery, and prostate artery embolization. There are various homeopathic medicines which can be given in case of benign prostatic hyperplasia based on symptom similarity. Some of these medicines include Sabalcirulator, Conium maculator, Cantharis vesicatoria, Sarsaparilla, Lycopodium, Beritacarb, Clematis erecta, Chimaphila umbellata, and Thuja occidentalis. Now it's your homework to write the indication of all these medicines from the book. So this was all about benign prostatic hyperplasia. Your homework is to go through the book, and you have to see and write in your notebook what is benign prostatic hyperplasia, what are the various clinical features, investigation, and management from the book. In the next lecture, we will be discussing about prostate cancer and renal adenocarcinoma. So this was all about benign prostatic hyperplasia. In the next lecture, we will be starting with a new topic. So this session is powered by digital version 2.0 JAYOTI VIDYAPEETH Women's University. I hope the session is clear to you. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. Have a good day.